Phenotypes of Multiple Sclerosis, What They Do and Ways to Make Them Not, by Lori Smith. Multiple sclerosis, or MS, is an inflammatory disease that affects the central nervous system, the CNS, which consists of the brain and spinal cord. MS is considered an autoimmune disorder because the body's immune system attacks its own tissues. The immune system causes inflammation that destroys the fatty protective substance, the myelin sheath, that covers nerve fibers along the CNS. These damaged areas develop scar tissue, leading to the disease name meaning multiple scarring, or multiple sclerosis. The resulting scar tissue is referred to as a lesion. The presence of these lesions constitutes a significant indicator of MS. Symptoms of this disease are referred to as relapses, attacks, or flare-ups, and are generally the first indication of MS. These symptoms present themselves depending on which area of the CNS is damaged. MS symptoms are unpredictable and vary between patient to patient because no two cases of MS are identical. MS affects approximately 2.5 million people worldwide. People living with MS are capable of living full, enriched lives. Although this disease can affect both men and women, MS affects women more than men with a ratio of 3 to 4 to 1. The onset of the disease usually occurs during young adulthood, between ages of 20 to 40, but can be seen at any age. Diagnosing MS is a challenging task because many symptoms mimic other conditions. A thorough combination of clinical examination, radiological assessment, and laboratory tests of blood work remains currently mandatory to provide a proper diagnosis of MS. Magnetic resonance imaging, MRI, is used to locate white matter lesions on the brain and spinal cord. An annual MRI is conducted to time-frame the disease course activity and to track and monitor the disease progression. An early diagnosis of MS allows healthcare teams and patients to manage and monitor the disease development, ideally controlling and hindering disease flare-ups. To understand each phenotype of MS, we must explore the pathology of the disease. The central nervous system, the CNS, which consists of the brain and spinal cord, is the complex network of nerve cells responsible for sending, receiving, and interpreting information from all parts of the body. Although each signal may be small, each signal is necessary to generate the actions, sensations, thoughts, and emotions that encompass the human experience. Comprised of lipids and proteins, the myelin serve as an insulation to protect the axons along the CNS. They also allow nerve signals to travel quickly from one part of the body to another or to the brain. As ongoing inflammation and tissue damage occurs to the myelin sheath, nerve signals are disrupted, leading to a deficiency in the ability of nerve cells to properly and accurately transmit signals. Demyelinated lesions may become present in the white and gray matter of the CNS, including the cortex, the basal ganglia, and the brainstem. The resulting scar tissue blocks and obstructs the flow of messages between nerves and muscles. When myelin is damaged in MS, communication between the brain and the rest of the body is altered or stopped entirely. No two MS patients will have identical lesions or face the same disease progression. The different types of MS each have different disease courses. People with MS typically experience one of 4 disease courses identified as phenotypes. There are 4 types of MS, named according to the way the disease acts on the body over time. Multiple sclerosis phenotypes are defined by the status of the disease activity and its progression. Each form of MS comes with its own challenges and different severity of symptoms. To identify the particular phenotype of MS, the current disease state must prove activity. Such activity is required to be evidenced by clinical relapses lasting at least 24 hours, or MRI imaging showing new or enlarging T2 lesions. The disease must show an assessment of progression. Disease advancement must be proven with clinical evidence of disability worsening over a given period of time. To further identify the phenotype of MS, a spinal tap is performed to examine the cerebrospinal fluid for the presence of specific oligoclonal bands, which will suggest CNS inflammation. Once identified, MS is categorized as either clinically isolated, relapsing remitting, secondary progressive, or primary progressive. When someone has an experience or finding that may be MS, but they do not yet meet diagnostic criteria, they are considered to have clinically isolated syndrome, CIS. To qualify for relapsing remitting multiple sclerosis, RRMS, an MRI will reveal at least 2 lesions in the brain or spinal cord. The abnormal proteins, oligoclonal bands, within the spinal fluid must be present. Evoked potential testing measures the time it takes for nerves to respond to stimulation. In RRMS, this testing may reveal hesitation in the optic nerves, brainstem, and spinal cord nerve transmission. In relapsing remitting types of MS, a symptom will present itself for a period of time, thus considered a relapse, attack, or flare-up. Although the patient has experienced a symptom, it may dissipate. and they will then experience partial or complete recovery, known as remission, where they experience no symptoms. During this time, the nerves will try to repair themselves and may form new pathways to get around the damaged nerve cells. 85% of those diagnosed with multiple sclerosis are diagnosed with the RRMS. Some people who are diagnosed with RRMS will eventually transition to a different phenotype called secondary progressive MS, SPMS. Disability gradually increases in SPMS with or without newly discovered activity evidenced in relapses or changes on an MRI. Considered a rarer type, primary progressive MS, PPMS, does not involve as much inflammation as relapsing forms of MS. PPMS is characterized by worsening neurological function and an accumulation of disability. Caused primarily by nerve damage, the main symptoms of PPMS do not tend to fall into a remissive state to heal or subside. Each phenotype of MS has its own unique characteristics and effects. Understanding the phenotype is important in handling the disease and deciding on which treatment is best given the patient's symptoms. Each form of MS comes with its own challenges and different severity of symptoms. This photo shows an MRI scan of a brain without lesions on the left, next to an image of an MRI scan of a brain with lesions caused by MS. Symptoms are the result of newly shaped CNS lesions and the growth of pre-existing lesions. Symptoms of this demyelinating disease vary depending on which area is damaged. These symptoms are unpredictable losses that may be temporary or permanent. An incredibly common symptom that MS patients experience is muscle weakness in their extremities, making it difficult to pick up even a coin. MS patients also frequently have difficulty with stability and balance, leading to a decline in muscle coordination. Often these symptoms may become severe enough to impair walking or even standing. MS has the potential to produce partial or complete paralysis. Most people with MS also exhibit abnormal sensory feelings such as numbness, prickling, or pins and needles sensations. Some MS patients may also experience headaches, pain, blurred vision, speech impediments, tremors, and dizziness. Experiencing cognitive impairments such as difficulties with concentration, attention, and memory are incredibly common symptoms, affecting almost half of all people with MS. Although mood swings that can occur may or may not be in direct relation to physical symptoms, depression is another common feature of MS. For a patient with MS experiencing symptoms, it may seem like your body is quite literally beating yourself up. Dealing with any one of these symptoms can be frustrating. There's no need to automatically be alarmed if you've ever experienced one of these symptoms. Just because you may have exhibited one of these symptoms does not automatically equate to having MS. So what's to prevent you from getting MS? MS is not something that you can simply catch from someone else. Ultimately, the exact cause of MS is not known. It is believed that contributing factors involving genetic susceptibility, immune system abnormalities, and environmental factors may play a part. It's rumored that geographical location may play a part in developing multiple sclerosis. In this photo, shades a world map with regions of MS prevalence. Individuals who live farther away from the equator seem to be more likely to develop MS, perhaps due to a lack of sunlight. Although vitamin D deficiency is believed to contribute to MS, the exact cause remains unknown. Just as there is no exact known cause, there is no known cure. Without a clearly defined remedy, healthcare providers do their best to extend the patient's state of remission or length of time between disease flare-ups. Although currently available treatments for MS rely on modification of the immune response or the functioning of the immune system, they do not address the issue of lesion remyelination. Because these medications are unable to cure the disease, they are considered disease-modifying therapies, DMT. Medications, currently available as injection or pill form, are meant to reduce the frequency and severity of attacks and prevent the development of new brain lesions. Some medications may also slow down the progression of MS, reducing future disability. Choosing a DMT is based on patient preference regarding drug characteristics like how it is administered, efficacy, and safety. Because there is no cure, long-term treatment will be necessary. There are non-pharmaceutical options for inhibiting MS progression. Physical therapy and exercise are physical activities to retain body function. Symptoms such as fatigue, strength, balance, mobility, and quality of life are issues that many MS patients can enhance with exercises. Exercise and therapy are used to encourage longer-lasting remissions and may even improve function. Workouts must be approached with moderation in mind, because avoiding excessive activity and extreme temperatures are important measures patients should take to combat physiological fatigue. Patients also utilize various aids like foot braces, canes, and walkers to help them remain independent and mobile. We have identified 4 types of MS: clinically isolated syndrome, CIS, relapsing remitting, RRMS, secondary progressive, SPMS, and primary progressive, PPMS. The immune system causes inflammation that attacks the myelin sheath, leaving nerves exposed and vulnerable. The damaged myelin sheath inhibits the CNS from quickly and accurately conveying messages to the rest of the body. The damaged areas attempt to heal, but become scarred, leaving multiple scars, which translates to the name multiple sclerosis. An early diagnosis of MS allows healthcare teams and patients to manage and monitor the disease progression in pursuit of controlling and hindering disease flare-ups. There is no exact known cause of MS and no cure. Disease-modifying therapies, DMT, are medications intended to reduce the severity of symptoms and inhibit the development of new brain lesions. Pictured here is a timeline of developments in the treatment of multiple sclerosis. With such recent advancements in promising DMTs, one day, we just may see a cure. Non-pharmaceutical options like physical therapy and exercise in moderation are used to encourage longer-lasting remissions and may even improve function. Phenotypes of multiple sclerosis, we now know what they do and ways to make them not. Further understanding of MS will insist in the recognition and identification of other diseases. Continued research of MS will lead to prolonged treatments and, eventually, a cure. Until that day, people with MS don't have to feel limited by this autoimmune disorder because they are still capable of living full, enriched lives.